Thank you, Matthew. Good morning, supervisors. I'm happy to be here with you today. I'm just going to share a brief presentation and happy to answer any questions that you may have around COVID-19 activity in our community. So this is one of our proudest slides. We are at the tail end of what we call our epidemic curve, and we're affirmed in that we are at this tail end because we've done a significant amount of testing. So it's not due to lack of testing that we're seeing a drop off in cases. This is a real curve and we are at the tail end, and it's really because of the work of our community working together to flatten the curve. A lot of the cases that you see in the peak reflected an outbreak in the canal area of Marin County. And we're just thankful to the partnership that we had with our neighbors, community-based organizations, civic leaders, and philanthropy, as well as healthcare partners and local governments who all came together to flatten the curve and to respond to an outbreak that was happening in our community. So we have achieved success in that outbreak and are now benefiting from that. Unfortunately, we're seeing nationwide an uptick in cases across the country, and that is driven by a lot of practices and behaviors that are not allowable in the state of California. And we're fortunate to have been very conservative in implementing strict preventive measures at the beginning of this epidemic. And we are now seeing that when those preventive measures are not in places in states across the country, that they are now realizing a second wave of COVID-19 activity in communities across the country. We're fortunate right now, if you look at this map that's offered by the Centers for Disease Control, to be in an area where there's significantly lower prevalence of COVID-19 activity. And you're seeing where the upticks are at the darker blue is where there's much more significant COVID-19 activity. Just for framing, this is the case rate or the number of cases reported in the last 7 days. And we in Marin County are less than 3, and you're seeing in parts of the Midwest of our country cases exceeding 70 cases per day. And so that's obviously a very significant difference. We need to be wary though, because we travel widely in our country, even with restrictions across the nation on activity. We've seen air travel pick up significantly and other business activities pick up significantly. So we need to be prepared for the reintroduction of COVID-19 back into the Bay Area and into our community. But the good news is we still remain in orange. We achieved that tier last week. We officially entered into tier 3 or orange or moderate activity. We are, when we entered into that tier, we had an adjusted case rate of 2.6, which is extremely low. That's the number of cases per day, per 100,000 individuals. We have an adjustment because we have high levels of testing that exceeds the state average in testing that provides us benefit with that adjusted case rate. And we're also seeing a significantly lower positivity rate, or the number of tests that test positive for COVID-19 is less than 2%. And that's actually in the yellow tier, or minimal activity of COVID-19. We are also very proud of our health equity measure. I think it's even more important on days like today. We truly have been equity focused in our approach towards addressing this epidemic locally, and have been committed since the beginning in providing additional resources and supports to communities of color across Marin County to battle this infection. And one of our proudest outcomes is that the equity measure, which is the difference between the lowest quartile of census tracts based on the Healthy Places Index compared to the rest of the county, we're not seeing significant differences. And we're actually seeing that number continue to decrease. And again, I think it's because of the county's strong commitment to equity and working in partnership with communities of color across the county. So the predicted tier level for this week, it won't be official until Wednesday, actually. Normally they post the tier on Tuesdays, but due to the election, the state has already notified us that they will be posting our updated tier status on Wednesday, even though the date frames or the time frames for analyzing data won't be changed. We are expecting to stay in tier 3 or orange. We are expecting to see actually a drop in our new COVID cases per day down to 2.6. We're also expecting to see a decline of our positivity overall to 1.4%, and an additional drop in that testing positivity in the lowest quartile, which is 2.4%. I know everyone has experienced going from purple to red to orange, and the next step is, when is yellow coming? And that is a very far reach. We are not anticipating that we'll reach yellow. Our biggest focus right now is staying orange, especially with the activity that you're seeing nationwide. But we would need to have that case rate drop below 1 in order for us to reach yellow. So it's a much stronger reach than this tier, especially with the high amount of COVID-19 testing that we're doing in the community. To imagine only seeing 1 new case per 100,000 in Marin County, it seems as a far off goal. That being said, we will continue to endeavor to achieve yellow, but more realistic, I think, is staying in orange. So this is a slide that gives Dr. Willis and I both pause, because being in orange comes with significantly increased activity, and the more activity there is in the community, the higher risk of COVID-19 transmission. I just want to reassure the community that these allowable activities are safer because our partners in the business community have really taken to heart the need to implement their site-specific protection plans. And so even though we're opening more activity, it is a guided opening that has limited capacity and still has, again, restrictions, including face covering when engaging in indoor activities and other guidance to keep it a safer business practice. And what is also new is we now have bars and breweries that are now allowed to operate outdoors. And the emphasis for us is always the importance of the outdoors. COVID is adverse to the outdoor environment. So the more we can maximize outdoor space, the better. So our challenge, as I'll say repeatedly, and you'll hear this from Dr. Willis as well in the weeks to come, is really staying orange. We want to avoid the return to tier 2, which will be very challenging for us to avoid returning to red, especially with the activity that you're seeing nationwide. And it's really going to be dependent on neighbors and businesses working together and staying vigilant and keeping our guards up against COVID-19. And it's really going to be driven by individual behaviors and decision making that could reintroduce higher levels of COVID-19 activity into our community. And we've struggled, we've seen our community struggle with local businesses struggling to stay afloat when there were such restrictions in place on their activities. And I think this is another time for our community to come together and to keep businesses open by following all the guidance that's in hand. Because if we do go back to red, we would see reduction in both the allowable businesses as well as reductions in the percent capacity, which would be another blow to local businesses who are really working hard to stay afloat and get business going. We are committed to trying to have voluntary compliance with our health order. We still have a health order in place. It's a risk reduction health order, which again shifts a lot of responsibility to individuals and local businesses and partners. But this is what we're aiming for, is voluntary compliance. If we do not achieve voluntary compliance and we continue to hear of violations, we are preparing to have a response from public health, which would include, hopefully just include a written warning from the health officer directed towards a specific business that is out of compliance with its site-specific plan. And the one that we would like to avoid is issuing an order to close a business because of engaging in activity that promotes communicable disease spread, which is one of the powers that a health officer does have in an epidemic and a public health emergency. This is the power that we do not want to enact. So we really are going to be working with our Marin Recovers partners to, I think we have a very shared goal of staying orange and keeping businesses open and pushing towards yellow, which will allow even more business activity in our community, and hope that we can work together in partnership and to achieve that and to avoid unnecessary enforcement. So in addition to businesses opening, we also are seeing schools opening. We are now in tier 3, which is changing some of our recommendations in public health as it relates to schools. Most notably, it's how parents are evaluating symptoms for children before sending them to school. When we were in tier red, we enacted a strict policy that even a child with a runny nose would need to be evaluated by a healthcare provider before going back to school. Now that we're seeing that there's a significantly lower amount of COVID-19 living in our environment, that is beyond a conservative approach. It's not an appropriate clinical approach to evaluating a runny nose. So for example, now a child has a runny nose, they improve, they can go back to school if they're symptom-free for 24 hours. If they have more symptoms that are more indicative of COVID-19, you may have heard that loss of taste or smell is a classic COVID-19 symptom. We are requiring testing for them to return to school, as well as if they have 2 or more symptoms in the COVID-19 list that the CDC provides, we would require testing for them to return to school. Again, a lot of the responsibility really shifts to parents in keeping a safer school community, which is really driven by limiting social activity. Notably, we have increased the number of cohorts that students can participate from 2 to 3. So now a child that has returned to in-person instruction can go to school, attend an aftercare program, as well as participate in an outdoor sports, as long as the sports are following state guidance on how they should be participating in those sports. And important for us is just sharing the data with the community. We have more than 200,000 student days. We'll be approaching 300,000 student days by the end of this month. And that's the number of students attending in-person school by the number of days they're in school. And we still do not have any suspected school-based transmission. And I think this is just showing the partnership that we have with the Marin County Office of Education and local school districts on implementing our 30-point guidance document for creating a safer school environment. That being said, COVID is going to enter the school environment. We have investigated already, sorry, it's covered up, 7 cases. And we implement a strict cohort closure model in the elementary school and a case investigation and contact tracing approach to ensure that we are identifying all close contacts in the school environment and to prevent that school-based transmission. But we will expect to see those numbers increase, especially the cumulative number of positive students and staff. Our job in partnership with local schools is ensuring that we can decrease the risk of COVID-19 transmission on that school campus. And you can go online and our website and see which schools are open and up-to-date activity. And this is updated every Friday. So our biggest risk is that second wave. We're seeing it across the nation. Again, it really is up to us. We have things we know we can do and can avoid in order to prevent an increase in COVID-19 activity. We are absolutely expecting a second wave. Our goal again is to flatten that curve and to reduce the magnitude of that wave by following public health guidance. The driver that we're seeing in Marin County now, the most common driver, is not through crowded housing situations that we saw with the canal outbreak. What we're seeing now as the primary driver of COVID-19 in Marin County is voluntary private gatherings, where we're seeing households not following the state guidance, which prohibits more than 3 households gathering. The state guidance also says the households, when they do gather, should gather only outdoors and wear face coverings. And so when we are seeing the new flux of cases of COVID-19 in Marin County, generally what is behind the story is that someone attended a party or a small party with more than 3 households. And again, as you increase the number of mixed households, you increase the risk of possible exposure to COVID-19. Then upon us is holiday and winter travel. We're going to be seeing a number of students returning from colleges and universities across the country. We'll be communicating with parents on how to talk to their students about the activities they may have engaged in as a healthy young 20-year-old at college before returning to Marin County, and then determining if they should take more serious measures of self-quarantining at home because they engaged in riskier behaviors before their return to Marin County. And then as we move into the holidays, really considering if this is the time to travel, especially if you have someone who you're close with, either who lives with you or you provide care to or support to, if they're more vulnerable. If you're going to be traveling to any of the states in the map that I showed that are darker blue, there's inherent increased risk of contracting COVID-19 because there's more COVID-19 circulating in those communities. If you do leave the state of California, we are recommending this time not to adopt local practices and customs, but to continue to maintain your California customs of wearing a face covering, maximizing physical distancing, optimizing time outdoors. And if you go into a crowded restaurant that feels like it's more than 50% capacity in another state, to consider an alternate destination, because that's, again, those indoor activities, when there's high COVID activity with less restrictions, increase the risk of COVID-19 transmission. And absolutely to go onto the CDC site and check to see what is the case rate and if it continues to increase in the area that you plan to travel to. And lastly, as Supervisor Rice said, today is election day. We know many people have already mailed in their votes, and you can still mail in your ballot today. If you do go to the ballots, to follow all of the requirements that will be posted everywhere, make sure you're wearing a face cover, maintain that physical distancing, bring your own hand sanitizer on site. We're really thankful to the registrar of voters, Linda Roberts, and her team. They've done a tremendous job in ensuring it's the safest possible environment for those individuals who choose to vote on site. But voting by mail is still the safest approach to vote. And Dr. Willis and I cannot end a presentation without telling everyone to get their flu shot. I'm sure of the people that are on this call, there are some of you that haven't received your flu shot yet. We've already seen that flu and COVID-19 co-occur in an individual who lives in Solano County. And so that one tells us that flu season is here. So we are detecting flu activity in the community. Two, it tells us that they can happen together. You can get both COVID-19 and flu at the same time. And if you have other chronic conditions, that could significantly increase your risk of hospitalization and even death. The one thing that we do have that is tried, tested, and true is safe and effective flu vaccines. So this is the season to get your flu vaccine now. There's no reason to wait. There's no reason to wait to see if it's effective or not. We do not follow that. It's about the match of a flu vaccine, and any dosage of a flu vaccine, even if it's not a perfect match, will provide you protection and allow your immune system to detect flu more rapidly and bump up your immune response. So get that flu shot today. And that's it. Thank you very much.